Welcome to Health Break, your go-to podcast for health and wellness at Polk County Public Schools. We'll give you tips and strategies that you can use in your daily routine that helps promote a better, healthier you. We'll also tell you of all the amazing services offered to our PCPS staff through our healthcare programs. Let's take a journey to better health together.
Hi, and welcome back to Health Break. I'm Erin, your wellness coordinator, and today I have Rose, who is the oncology nurse navigator for Johns Hopkins. She's with us from Baltimore, Maryland. Hi, Rose. Thanks for joining us today.
Hi, Erin. Thanks for having me.
Of course. I just wanted to start this out. If you could tell us a little bit about your background, your expertise.
Yes, I am an oncology nurse, which is a nurse that works with people that have cancer. I have been an oncology nurse for almost 30 years. I've worked mostly inpatient hospitals or clinics throughout my career. And I started with Johns Hopkins in 2018 in this program, WorkStride Managing Cancer at Work, which continues to help people who have cancer or who may have questions related to cancer.
Awesome. Thank you for that. Can you tell me a little bit more about the WorkStride program? How do people enroll in this program? What are the benefits of it? All of that fun stuff.
Yeah, so WorkStride Managing Cancer at Work program is actually a free benefit for all employees. It is not something that anyone needs to enroll in. It's free and it's confidential. So it's a matter of making a phone call, sending an email, or going onto the website and sending a message that they need to talk with an oncology nurse navigator. So the support comes with the oncology nurse navigator in terms of if someone calls and has just a question even about cancer, or if they themselves have a new diagnosis, they're connected with an oncology nurse, and that oncology nurse navigator will stay with them throughout their course, whether it's, they have to have treatment or don't have treatment, they're assigned to the same nurse. The nurse provides support in terms of local resources, information. She can review pathology reports in terms maybe suggesting second opinions, making sure they're getting the standard of care. Now, they're not the treating nurse. They're a second layer of support. So they will reinforce what a person has been told by their medical team, or they will help their family member get to resources, get to screenings. Maybe someone smokes and they want to get a low-dose CT scan. We can help them find that resource.
Very cool. So it's like having a best friend or a nurse in the family that you can, rely on and help kind of sift through all of the information that you get when you get a difficult diagnosis, such as the ones we're talking about.
Right. Yes, that's a great way to put it. And they also help to advocate, have the employee advocate for themselves, because when someone's diagnosed with cancer, they don't know what they don't know. So
right.
They may not even know what to ask, and they may not even know how to advocate and say, well, these are my goals and how do I get there? Of course, we all want the cancer to go away, but there's other life goals that people need to consider.
So we talked about, all of the great resources that your program offers for individuals or family members. Are there any resources available to managers or supervisors who have an employee that has this diagnosis?
Yes, there's a whole section on the website. So we have a website, the WorkStride Managing Cancer at Work website, where there are over 50 videos that people can view. Now, there's a whole section for managers, and there's some role-playing videos. So how does a manager actively listen to someone that comes to their office and says, I have cancer, what they can and cannot say. We can help a manager feel comfortable with those conversations and help the manager understand the rights that a cancer patient has under the Americans with Disabilities Act. So there's a lot of information in the website, not only for the employees, but also for the managers and supervisors.
That's great. Are there any lifestyle behaviors that kind of make us more susceptible to getting some forms of cancer?
Yeah, there, of course, in terms of any chronic illness. So we're going to look at it in a holistic way. So what we want to do in terms of trying to reduce our risk for cancers in general, we want to make sure we're exercising. We want to make sure we have a good, healthy diet. What is that for an individual? We have to make sure we're sleeping, we're managing our stress, and we get our screenings, and we have a sense of purpose. That's very important.
That is. You mentioned screenings. Are there any guidelines for screenings? I know this is Breast Cancer Awareness Month, so can you go over some mammogram screening guidelines for me?
Yeah, so the American Cancer Society recommends women can start to screen between the ages of 40 and 44. Then from 45 to 55, screening every year, and after 55, every 2 years. Now, that being said, it's more of an individual assessment in terms of talking to your primary care provider or your GYN to see what is best for the woman, because everybody's family history, their physical history, their breast density, all of that is different. So it's really important to have that discussion with your doctor.
Okay. Can you give us an example, Rose, of like a case that really stands out in your mind of somebody that you've helped through this Work Strides program?
Yes. And this is, an extreme case, but I worked with a young woman who had a diagnosis of breast cancer. She was in a rural area, and the oncology team recommended a pretty aggressive chemotherapy regimen. She asked me, could I review her pathology and could I review some of the testing they did? And I did. I did review it. And I was a little bit uncomfortable with their decision to give her such aggressive chemotherapy. It didn't seem by her testing that chemotherapy was warranted in this situation. So I asked her, how she felt about getting a second opinion at an NCI designated cancer center, which is the National Cancer Institute designated cancer center. She was in agreement. It was about an hour and a half away from her home, but she went and she made the appointment, and she asked the doctor if I could listen in, and she called in and I listened. The medical oncologist was completely fine with it. And the medical oncologist also felt, based on the testing and the information, that she was not a candidate for chemotherapy. Anti-hormonal therapy, which is a pill that she would take for a number of years, was what was best for her. So that was a very significant change in her treatment plan based on a second opinion.
Yeah, that's amazing. And I'm sure that ultimately changed, her quality of life during treatment as well.
Absolutely. Absolutely.
That's amazing. That's an amazing story. Well, Rose, my last question for you is something that I ask all of our guests on this podcast, and it's, what's one small thing that our viewers can do every day that will ultimately make a big difference in their daily life?
I would say when they wake up every day, think about what they're going to do for themselves physically, mentally, and spiritually to help themselves be as healthy as they can be every day.
I love that. Thank you so much, Rose. I really appreciate you taking the time out of your day to talk with us. It was a super important topic. I appreciate your time.
Thank you for having me.
Visit workstride.org/Polk County Schools to access free resources on cancer screening, treatments, coping, and so much more. You can also contact a Nurse Navigator to begin your WorkStride journey. To learn more about WorkStride and our other wellness programs, visit wellness.polkschoolsfl.com. Thanks for joining us today. Do you have a question about health benefits or wellness? Head to polkschoolsfl.com/healthbreak to submit your question, and you may hear it answered in a future episode. Connect with us by subscribing on YouTube, Apple Podcasts, Google Podcasts, or Spotify, and join the wellness community. See you next time on Health Break.